Okay, hi guys. Right now I'm going to be going over Chapter 9. And Chapter 9 is on patient education and health promotion. So I'm going to be going over the slides for this, and I'm going to be sharing the screen right now. So give me 1 second while I get that done. Okay, so you should be able to see this right now, and I'm going to just be speaking over these slides. Chapter 9, this is patient education and health promotion. Here you're going to be discussing the purpose of patient education. You're going to use patient teaching to promote national goals of health promotion and disease prevention as listed in Healthy People 2030 and the Health Canada. You're going to describe 3 ways in which people learn and correlate the importance of these types of learnings to teaching. List and differentiate between conditions and factors that affect learning. Describe barriers to teaching and learning. Identify adjustments to the teaching plan needed for teaching the very young patients or older patients. Discuss types of resources available to assist in patient education. Name 3 things that must be included in documentation of patient education. Describe ways in which teaching can be continued following hospital discharge. In clinical, you should be able to assess and assign patients' learning needs, develop an education plan based on the patient's learning needs, implement the teaching plan at a pre-arranged time, evaluate the effectiveness of the teaching and the plan. Preventing illness or promoting wellness. This is the purpose of patient education. Nurses teach patients about their disease or disorder, diet and medications, treatment and self-care. Prior to discharge, the patient must be able to, prior to discharge, the patient must be taught how to care for himself at home. Patient teaching begins at the time of admission. This is a common concept that I think is important to know. New nurses or nursing students may believe that teaching only happens um, at the end of a patient's stay, but actually the truth is patient teaching is happening kind of right away. You just get to know the patient, you're assessing them, you're teaching them, you're guiding them. Nurses' whole role is really to be a teacher. So patient teaching really begins at the time of admission. I think that's an important mark to know and something we might see in our study guide. Anything I add in the study guide is a concept that I want you to know, not memorize, but know. Purposes of patient education, assessment of learning needs, prepare a plan, assess learning needs, factors affecting learning, cultural values, confidence and abilities, readiness to learn, and form a teaching plan, collaborate with other health professionals. So what does assessment of learning needs mean? That means that you are preparing a plan, and you can only prepare a plan if you assess the patient's needs. So you need to go to that patient and you need to see what is it that they need from me and how can they learn from me best. That is what that means. And what do they need? How can I assess them and evaluate what would they need from me? Um, do they need visual demonstrations? Are they someone that likes to read informational pamphlets? Is it a kid that needs us to demonstrate on a toy or on a plushie, something like that? So you want to always make sure that you're assessing learning needs. Every single patient is going to learn differently, just like how every student learns differently as well. So you will still have some type of universal plan that would work for everybody, but you are going to make adjustments for each patient based on what they are presenting to you. We've already talked about different factors that can affect our learning. This should have been re-emphasized also in our last chapter. And we want to make sure that we form a teaching plan and we collaborate with other professionals. So not only are they going to need advice from a nurse, they're also going to need other information that is, responsibilities of maybe other healthcare team members, but you're still going to have to present this information to them upon discharge at least. So you're going to want to make sure that you're collaborating with your other health professionals so that you know what it is that is in your patient's plan, because it's not going to be just information or instruction from you. You may have had to reach out to a cardiologist and they may have given you different insight than what you've gathered on your unit. You might be working on a different unit. For example, what I can apply to you is I guide and oversee patients who are pediatric patients, young patients, kids. And this is on a psych unit. But just because I'm on a psych unit doesn't mean that they don't have any other medical conditions. So we do still have to collaborate with cardiologists. We get EKGs to check heart function, and sometimes cardiologists will come up and see the patient and give them different information on what they need to do when they discharge. And I need to be aware of what that means, what the instructions are, how to teach them, and how to reinforce it, even though it didn't come from me. Okay. Modes of learning, as I just mentioned earlier, there's visual learning, which is what they see with their eyes. There's auditory learning, what they hear. It may be coming from me, something that I'm saying as a nurse, or maybe they need to listen to a YouTube video, or they need to watch a video that they find online that can kind of guide them. Sometimes people learn better when they are spoken to. Kinesthetic learning, by actually performing a task or handling items. So likely you are going to use all three of these as a nurse. You need to combine different things to make it effective for your patient. Kinesthetic learning, I think, is the most beneficial, and that's kind of what type of learning that you really receive during clinical. It's you using your hands to perform a task, to familiarize yourself with a certain skill. And when you practice with your own hands and with your own independence, you're able to learn a lot more. So, what you will see in long term care facilities is sometimes you will have to teach a patient how to check their sugar if they're diabetic. How do you clean a finger? It goes down to really the basics. How do you wipe a finger? How do you prick the needle? How do you obtain glucose? Also, how to self inject. Some of these patients are independent and they like to self inject their insulin. So sometimes we teach these patients how to do this and they perform this themselves. And this is part of kinesthetic learning. It's performing a task or handling the items themselves. I think that's a very effective way to learn something as a patient and even as a student, of course. So my notes here on the PowerPoint presentation is saying that one route is typically dominant for a patient. How would a nurse determine a patient's mode of learning? I'm going to give you a few seconds to reflect on that. What do you think you would do? So I'm going to give you about 10 seconds. I want you guys, when I give you these moments to reflect, to actually answer the question in your head or out loud. This will reinforce your teaching. So, how can a nurse determine a patient's mode of learning? It's definitely by assessing and meeting the patient and also asking. You need to ask them, how do you learn best, or how can I help you best? Is it by me showing you something? Is it by me speaking to you about something? Or is it by me performing the task first so that you can see how it is? And then for you to perform it in front of me so I know that you've learned how to do it. Okay? So, why is this paused? So I want to make sure that you guys understand that there are different modes of learning, and you're going to combine a lot of them. Even though one may be dominant, you're going to combine a lot of them. The knowledge check here is how do you teach somebody how to do a dressing change? Because patients are going to have to perform their own dressing changes sometimes. So it would be a combination of all of these. It would be the visual learning, what they see. It's going to be auditory by you reinforcing them and guiding them. And then it's also them kinesthetically learning, which is them applying the dressing in front of you. And then you let them know what was done correctly or what was not done correctly. Okay. Assessment of learning needs. To prepare a teaching plan, assess patient for knowledge of his disease, diet, if related to the disease or condition, activity regimen or limitations, medications, self-care at home. Prioritize learning needs so you can concentrate on teaching essential knowledge first. Okay, so it's best to know what a patient knows already because you want to be as efficient as possible as a nurse. You don't want to be teaching them about something that they already know about. Some of your patients actually might also even be former nurses and stuff like that. So you don't want to treat everybody as if they don't know anything. Our best thing as a nurse is to always assess first. So you want to make sure that you see whether or not they have any information, and this can also save you time. So we want to know what is his knowledge of his disease. Um, Diet can be important for their disease or condition, like diabetes, activity regimen, or limitations. Medications. Do they take their medications as prescribed? Are they not taking their medications? Can this interfere with their learning needs? Because if they're not taking medications that they need, for example, maybe somebody with ADHD, they're not taking their stimulants to focus. How can they grasp what you are teaching them or what needs to be understood if they are not even taking their medicines at home? Self-care at home. Sometimes patients are embarrassed to tell their nurse that they don't know what you're saying. Actually, this happens very often. And this even happens with patients who have had the disease for a very long time. So you may come in with the assumption that they should know what's going on. They've had this for 10 years. How do they not know? I'm sure millions of people have told them, no, they are your patient now. And in the present moment, it's your job to assume that they don't know anything. But you are going to knowledge check them and you're going to see what they do know. That way you can save yourself time. One, two, treat them like a human, that they have some type of understanding, and maybe they don't. But that's for us to understand. But we need to assume first that there's no knowledge until we assess for sure that there is some knowledge. Issues are perpetuated by patients' fear of revealing their lack of understanding. So a lot of patients, they don't feel comfortable saying, I don't know how to do this. And that's why teach back is very important here so that we can see whether or not the patient has grasped what we have said. If not, we're going to try a different learning mode. Factors affecting learning. Assess for factors that might interfere with the patient's ability to learn. Poor vision or hearing, impaired motor function, illiteracy, and impaired cognition. Age may interfere with the strength or dexterity for performing certain tasks. So we kind of did touch on this even in the last chapter. There's many things that affect our patients and what they're able to understand of what's being communicated. And this can depend on one, or their level of education. Two, it can also be, like I said, something as simple as you didn't put the hearing aids in or you didn't give them their glasses. Maybe you didn't give them their cane to be mobile and be productive in what you're trying to teach them. Maybe you're giving them a task that requires some type of mobility, but you didn't give them their assistive devices. How can they feel comfortable learning something if they're not in their normal state, if they're not in their most aware state? So that is for the nurse to evaluate first before she teaches something. Age may interfere with strength or dexterity for performing certain tasks. So if somebody is more weak or more frail, they may feel more anxious to perform a task, or maybe they are unable to perform that task. And that is for the nurse to assess that. Patient teachings. It's usually recommended that it should not be materials that are beyond a sixth grade reading level. So that may be shocking to a lot of us, but medical information is very dense. So it's in our best interest to make it something that's very concise and clear and that doesn't invite too many questions from the patient as well or too much confusion. So it really does benefit everybody. Um, Patients who are tired, in pain, anxious, or distracted with the environment are less likely to retain the information presented to them. So, if you did not assess them for their physical needs, they are unable to take care of their mental needs. What this means is if they're currently anxious and you are about to go spill them a whole novel about what they need to take care of, you're only going to contribute to their anxiety even more because you never addressed their anxiety to begin with. Maybe you have the TV on, or the patient has the TV on in the background and they cannot focus on two things at once. You need to make sure that the environment that they are learning in is productive. Okay. So that can even also mean that a family member is in the room and they're interfering with the information that you're trying to present with them. The nurse has to assess what is the most effective environment for this patient to grasp what I'm saying. Maybe you need to medicate the patient for pain. If they're in pain, they're not going to be able to focus. When you're in pain, you're not going to be able to focus. We know that ourselves, so we should not expect that from a patient that is suffering and in a hospital or in a long-term care facility. Physical, occupational, or speech therapists can be helpful in assisting the individual to overcome these types of problems so teaching can begin. So it's not just really us that teaches, of course, there are other intercollaboration team members that will also assist in teaching and also assist in monitoring effective learning styles, but the nurse is present with the patient most frequently, so you want to make sure that you know best. Readiness to learn. Assess patients' readiness to learn. Motivation plays a large role in effective learning. Work with patients to show them the advantages of learning what they need to know. So, this is also something that you will practice every single time you are with a patient. You will be assessing, is this patient ready to receive the information that I'm trying to teach them? Or are they distracted? Or do they not care? Um, or is it something that they're not ready to give up? For example, we can think of this with smoking. Of course, everybody knows that smoking is not healthy for you, but there's a lot of patients, and I'm sure there's students even here in our class, where we know it's not good for us, but we're just not ready just yet. That doesn't mean that that opens up the opportunity for us to not care or for us to not do anything about it. It just means that this person might need a lot more support. Um, So it is still our duty to assess whether they are ready to learn, whether they have accepted our feedback, or whether they have refused our feedback. That's also something important that the nurse will have to document. So when I'm teaching something to a patient, I am documenting after I have reviewed in the documentation what skill or what I have just tried to educate them on. I then say patient verbalized understanding. Um, If my patient refuses, I'm writing patient refused educational teaching by writer, comma, risks and benefits explained to patient, comma, patient still refused. So it is our job and duty to assess our patient's readiness to learn, but they need to know why it's worth it for them to know, especially if they're not ready to learn. They need to know what can they gain from this? Why is this worth it? Someone will be more likely to change their behavior or to learn and be educated about a certain thing if you are showing them what the advantages of learning are. Um, but this comes from independence. It's just the same way I can describe readiness to learn as a student. Are you ready to learn? Are you ready to complete your assignments on time? Are you ready to do your study guide, or are you feeling unmotivated? Do you feel like it's not worth it? Do you just think it's a lot of busy work or just things that are unnecessary? As I am interacting with you guys, I'm also getting familiar too with your readiness to learn. Are you willing to do the work? I can teach you, but it's up to you and your independence to learn and to grasp and to feel ready to learn and accomplish your goals. Motivation, as you see, is a large role in effective learning. So it's up to us. It comes from us or the patient. And then, yeah, we are just more willing to do something if we feel that there's an advantage to it. Cultural values and expectations need to work within patients' values and cultural systems. Values and expectations can interfere with patients' ability to cooperate and learn needed skills for self-care. The patient's cultural values and personal expectations regarding treatment and recovery may differ from those of the nurse and other healthcare providers. It's important to plan patient teaching that respects and demonstrates understanding of their culture and religious beliefs. If not, it's unlikely that the patient will accept it. Um, so an example that I can provide here, I'll bring it back to my culture. I'm Indian, and there are a lot of cultural values that people from our culture like to do, like more holistic care. They don't like to use westernized medicine, so a lot of them will try different techniques in order to heal themselves, but sometimes that doesn't align with what a nurse is telling them from America. They may think that they can resolve these issues naturally. Sometimes you will come across these barriers, these cultural barriers with patients. Like I said, it's the most important thing for you to describe to them what is a risk of not complying, and then also what are the advantages of not of complying. Um, but you will also need to understand cultural values in order to get it. And you don't want to present yourself as judgmental when you're dealing with the patient. You always want to make sure that you are still endearing to a patient and allowing them to trust you. Confidence and ability. Often patients express a lack of self-confidence. Teaching may need to be broken down into very small steps. Assess what patients already know about the skills they need to learn so that you can build on their current knowledge base. I just kind of touched on that. You always want to make sure what they know first. That way you do less work as a nurse. And two, you can start at a level that makes sense for them. We did talk about how for younger children, play techniques is beneficial. They like that. When teaching older patients, they want you to typically go a little bit slower. And if something has a bunch of steps, whether what age you are taking care of, you always want to make sure that you are breaking things down where patients are able to absorb what you're saying instead of you giving them a list of things for them to understand. Special considerations when teaching older adults: provide good lighting, provide printed teaching materials in large text, encourage patient to wear glasses if needed, encourage patient to wear and adjust hearing aids, use short sentences and pause frequently, keep medical terms to a minimum, ask questions at frequent intervals. So memory for older clients, it's tricky because it's often impaired once they're older. It will affect your teaching style and it'll also affect some of their information retention. That's why it's really important to assess what their needs are because maybe they need to hear it a couple times before they actually genuinely get it. There's different methods that you can do to help an elderly patient. You can help guide patients with medication dispensers with different compartments so that they know what day is going on in the week and what pills they need to take in the week. There's so many different ways that we can guide a patient. Sometimes our older adults need written instructions. And like I said in many slides, you need to make sure that the environment is clear, they have their glasses on, they have their hearing aids on, okay? Especially if you're working with older clients, those are some of the initial questions that should be popping up in your head. The patient education plan. Preparing the teaching plan includes analyzing assessment data, establishing behavioral objectives, creating a plan to assist patient in reaching the goals in a timely and effective manner. It's essential that teaching plan be developed collaboratively with input from all the disciplines involved in the patient's care. So we kind of already went over this again. You need to assess the data. So did they listen? Did they not listen? You want to establish objectives. What are their objectives? This represents their desired changes or additions to current lifestyle, current behaviors, current attitudes, and this should be meaningful. These are like their goals. So you want to make sure that they're either changing or they're adding things to their life, or maybe they are removing things. They need to know what their plan is, which means giving them clear goals. And it's for us to create a plan. Consistency in teaching is important if the patient is to master and retain the new information. So another thing is yes, there are many modes of learning, but it can be very tricky for a patient if we are changing the way that we teach them the information. So if I'm telling them in one way and then I decide in an hour, maybe I should have tried it this way, maybe in an hour I decide maybe I should have done it that way. You don't want to confuse the patient and you don't want to overwhelm the patient. That is why the assessment piece is just so important. We need to gather very quickly what is the best way and most effective way for a patient to learn our material, and was it effective after you taught them? Resources for patient education, books, audiovisual materials, pamphlets, hands-on equipment, government agencies, hospital social workers, and patient representatives are good resources of information. Implementing the plan, my cat is in the back if you can even see me. Teaching done when visitors, physician rounds, and treatments will not cause interruptions. So what this means is you want to implement the plan, or in other words, test out to see if it'll work when they are not in an interruptive state, when they are able to actually grasp what you're saying. So you don't want to teach them something and try the plan when they've got visitors and they're busy and they're excited that their visitors are there, or the physician's there, so now all their attention is at the physician and they want to make sure that they're answering the physician's questions right. Or maybe they're getting a breathing treatment. Of course, you don't want to go all of a sudden while they're getting a breathing treatment and try to teach them something. So this needs to be a space, implementing the plan needs to be a space where they are ready to receive this information. Put yourself in their shoes. How would you like to receive a new instruction on how to do something? Do you want it in an interruptive state, in a stressful state, when your family member just came over? No, you want it when you are most equipped to take on that information. One-on-one or in a group setting, it depends on the patient and depends on the scenario. Patient should be comfortable. Comfortable refers to patient needs to be medicated for pain or medicated for anxiety. They need to feel happy. They need to feel content. Their needs need to be met. If they're hungry, they need to eat. You can't focus on teaching a new skill to somebody who is disoriented in a different direction. Keep teaching sessions short. Of course, you don't want anything lengthy. You want it to be clear and concise. Involve patient in the process. That refers to including the patient, letting the patient try out what you just learned, or as in have them teach you back what you just learned. If it's something hands-on, let them do it so that you can see. You may need to incorporate teaching into daily care. Daily care would reinforce the patient to refer to what you taught them, and it's muscle memory. So the more often a patient is demonstrating something that you taught them, the more likely they are to master this and actually incorporate this into their routine. It will become like second nature to them if you are effective. Evaluation involves obtaining feedback from the patient regarding what was taught. Use this feedback to determine whether effective learning has taken place. So, an evaluation, this is where you're saying, did it work or not? Okay, you're going to go to the patient, you're going to assess yourself, then you're going to obtain feedback from the patient. Did this work for you? What can I do better? Is there any other way that you would like me to teach this information? I can show you XYZ. Don't just leave it up to the patient to brainstorm how they can be taught. You need to have your resources first and then present them to them, because it might be also a mode of learning that they've never even seen before and that they would really appreciate. Use this feedback to determine whether effective learning has in fact taken place. So evaluation is where you're seeing if it worked or if it did. Okay, that is based on your own observational assessment. You are looking also at assessment data. And then you are also referring to the patient and asking them questions as well. Documentation, every nurse legally responsible for providing patient education. Documentation is essential. Patient education flow sheet may be used. Nurses' notes should be included. This is specific content taught, method of teaching used, evidence of evaluation with specific results. So I touched on this earlier. This is another point that will show up on your study guide. Nurses' notes should include specific content taught. So what did you tell them? What did you teach them? What was the area that they needed to be educated on? Number two, what was the method of teaching used? So did you verbalize to the patient how to do this? Did you show them a visual? Did you provide them with pamphlets? Did you provide them with brochures? Did you guys watch a video together? Did you have them teach back to you? Did you have them perform the task in front of you? You need to explicitly say what was it that you used? What was your mode? What was your method of teaching used? Lastly, evidence of evaluation with specific results. My cat just dropped something, sorry. So you need to see, you need to evaluate as a nurse. Everything has to be evaluated as a nurse, as in, was this effective or not? You can't just say, yes, it was effective. How was it effective? What changed? What was the specific data? What were the specific results? What were the specific outcomes? Okay. So teaching often occurs informally while performing a nursing task, such as administering medications. This makes it a challenge to consistently document patient education. So as it does say in this slide, we are legally responsible to provide patient education. You are going to see this in real world nursing. And it is documented, and you should be documenting this. A good nurse is documenting. If you did not document, it never happened. So if you never write in a patient's chart that you had ever taught them about anything, it's going to be a red flag. Documentation of learning subjects is dependent on what you are teaching the patient. Coordination with discharge planning. Specific learning needs should be discussed with all involved parties, including the patient, and the plan for teaching shared. So primary physician's office, home health services, family or significant others. Printed plan must be sent home with the patient. So upon discharge, most patients, as you guys also may have experienced as being a patient, you go home with a discharge summary. And in that discharge summary, if you guys have ever noted or seen, it does specify what they have taught you and what your learning needs were. And you will also see too, not only are you teaching patients, you are also going to be teaching their spouse, their caregiver, whoever is involved directly in their care. They're going to be included too, because sometimes some of these things that we're teaching is not going to be all falling on the patient. It's going to be falling on people who are there as well that take care of them. As a nurse, Rachel knows that teaching a patient is done to assist the prevention of illness or promotion of wellness. All of the following are true regarding patient teaching, except it is a process that begins within 48 hours of admission. Number two, the patient must be taught how to take care for himself at home before discharge. Number three, nurses teach patients what they need to know about their disease or disorder, diet, medications, treatments, and self-care. Number four, discharge planning requires looking ahead to what the patient will be facing when returning home. I'm going to give you guys 10 seconds to answer this question to yourself. You should be answering this question out loud. This will encourage you to think like a nurse, so please do it. I'm going to give you 10 seconds. Okay? Your answer. So this is an accept question. If you are seeing an accept question, that means that 3 concepts are true and 1 concept is false. So 3 concepts typically have a similar theme, and one should look absolutely wrong to you. If you have answered this correctly, you would have chosen number 1. I want you guys to now think to yourself, how would you correct this response to make sure that it's true? It is a process that begins blank of admission. So think about what you would answer right now. It is a process that begins within the beginning or the start of admission, okay? So the rationale here, it's a process that begins at the time of admission. With hospital stays being shortened, patient education has become an even higher priority that begins as soon as the patient enters the hospital, okay? Question 2. Madison is a student nurse who finds it easier to learn by performing a task. This is which type of learning? Visual learning, auditory learning, kinesthetic learning, or effective learning. So we'll take 10 seconds. This is kinesthetic learning, okay? I know that this is kinesthetic learning because kinesthetic involves me performing a task. So kinesthetic learning is learning by actually performing a task or handling items. Visual learning is learning through what you see. Auditory learning is learning through what you hear. Affective learning occurs when subject matter material is presented in a way that appeals to the learner's beliefs, feelings, and values. So I want to just kind of take a pause for a second and point out to you guys, it is important that you know these 3 modes of learning. So I need you guys to independently define what is visual learning. You need to be able to define what is auditory learning, and you also need to define what is kinesthetic learning. You also want to take note or understand an example of each, if not a couple of examples actually of each, or when it would be applied in the nursing world. And this is something that you will probably see on your study guide, okay? Henry is a nurse working in a physician's office setting. If he is teaching a patient to drop insulin and watches the patient perform this task, he is teaching in which domain? You have cognitive domain, you have affective domain, you have psychomotor domain. So take a second. So this is psychomotor because this refers to a motor action. So motor, think of movement. Motor is referring to me performing a task. Psychomotor domain, the learning processes information by performing a task. In the cognitive domain, the learner takes in and processes information by listening or reading the material. Affective domain, material is presented in a way that appeals to the learner's beliefs, feelings, and values. And there is no effective domain. So I'm going to also point out that I think it's really important that you guys know what is cognitive domain, affective domain, psychomotor domain, what is an example of each or a few examples of each. And I want it to be an example that you could actually apply in the nursing world. Moving forward, Kara is working in a rural health department. She spends most of her day teaching patients and families. She realizes several factors affect learning. Which one of the following choices affects learning? Cultural values and expectations, confidence and abilities, readiness to learn, environmental factors. So if I'm seeing in all of the above answer choice, you want to see if there's 2 answers that you know is correct, that means that it's all of the above, okay? So that's how you strategically think. This is a NCLEX tip. When you are reading a question and you do see that it's all of the above, I'm not talking about select all that apply, I'm talking about all of the above. If there is that option for all of the above and you see that two answers are correct, that means that the answer choice should be all of the above for sure. Okay? That is a tip for the NCLEX. Number 5, Holly is working in a geriatric setting. She understands when teaching the elderly, she should 1, keep the TV on and turned up loud so other patients can hear it. 2, use long sentences and speak rapidly to keep their attention. 3, use medical terms to describe all procedures and information. 4, review the information frequently and check for comprehension. I'm going to give you guys 10 seconds. Okay, your answer should be number 4, which is review the information frequently and check for comprehension. Anytime that you guys are also answering these questions, it's most helpful for your NCLEX and for any type of quizzes you guys are encountering in this course. If you get the correct answer, it's most helpful if you are creating rationales or fixing answer choices to be correct. So we will take this question, for example. Number 1, you would want to keep the TV off and turn it down so the patient can hear you. Number 2, you want to use short sentences, speak slowly and clearly to keep attention. Number 3, you would want to use simple terms to describe all procedures and information. Okay, so I hope you guys learned something. And I pointed out a couple moments where I felt that it would be most useful for a study guide. So please follow along. And yes, happy studying. This was Chapter 9, Patient Education and Health Promotion.